So pull up a chair for just a moment. I want to have just a little bit serious chat about dying, about your loved ones that when they face death. So if you have a loved one with a terminal disease, not a terminal disease, not even a terminal disease, but that is sick with a chronic disease, and they get hospitalized and they can't communicate for themselves, you're gonna have someone like me, an ICU doctor or an ICU provider or whoever, a nurse or whatever, that may ask you, do you want this? Do you want your loved one to have chest compressions and resuscitated if they are to lose their pulse? And it's a very important question because it will decide how they die. The way that they die, if you say yes, I want them to have chest compressions, when they lose their pulse, we will do everything to get them back. We will be very aggressive in trying to get them back. That includes chest compressions and shocking their chest, perhaps, and giving them medications to keep them alive. Their likelihood of surviving and leaving the hospital, even if we get them back, is extremely low, very, very low. It's very possible that their last moments of life will be very painful and chaotic while they pass away. I've seen it many, way too many times. So it's something to really think seriously about, that what's the best thing for them. We all know what we want. We want our loved ones to live as long as possible. We want that. We want that for us. But what is the best thing for them? What is the best thing for them? That is what you need to ask yourself when you answer this question. My dad had a terminal disease. He had idiopathic pulmonary fibrosis, which has a prognosis of like 3 to 5 years. After 3 years of having this disease, after he went to the hospital in the ICU and he was on BiPAP, a mask to help him breathe, I told that ICU doctor, he is not going to get a breathing tube and he is DNR. Do not resuscitate him. And he passed away a few hours later. And I know that that was the best thing for him. I know it. And I know it's the best thing for most patients when they come into the hospital and they're sick, in my opinion. So just please keep that in mind.